good morning to some, good afternoon to others. My name is Adam Kaufman. I'm here with the OSP team for today's live webinar on the future of digital transformation in healthcare. And we're just thrilled and excited to have this important conversation about how AI, automation, and data-driven insights are really shaping the future of healthcare. OSP is passionate about advancing healthcare through technology, and today's discussion is part of that broader mission. So very excited and privileged to have our special guest, Sameer Sethi, the SVP and Chief AI Officer at Hackensack Meridian Health. Sameer, thank you so much for joining us. Sameer has been a leader and at the forefront of digital transformation in healthcare. He has a deep expertise in AI, in data science, and healthcare operations, all the things it takes to actually transform and leverage technology. And his leadership is really helping bridge the gap between what is technically feasible and what's clinically impactful, and really around elevating real-time decisions for patient care. So again, Sameer, thank you. And let's start hopefully with an easy question. We'd love for you to tell us a little bit about yourself and in particular your journey to what you're doing today.
Yeah, absolutely. And thank you, Adam, for having me. I've been really excited for this conversation. So yes, I'm Sameer Sethi. I function as what they call now as an AI and Insights Officer. I'm with Hackensack Meridian Health. We are a health system based out of New Jersey, which comprises of 18 hospitals, close to 500 care sites in total, and 40,000 very enthusiastic and professional team members. I primarily have four areas of expertise that I help lead. One is data and analytics. This is where we bring data from multiple different data sources and start to create a source of truth for what is used for building signals and insights, which is my second bucket, which is a team that is good at that understands the business and helps take that data into actionable insights. This is by adding business logic to the data or combining different data sources to make sense with the intention of either explaining to the business what has happened, why it's happened, and then at times what is going to happen as well. The third is AI, which sort of is in the previous bucket, but the reason we call it, we think of it separately is because there's a lot of generative AI need as well. So we have a team that focuses on building use cases that use the power of large language models to do things like generation or summarization. So we have use cases that help synthesize data, consume data in a meaningful way using large language models that are available in the market. The fourth is RPA, robotics process automation. This is where we use or build or write code to emulate human functions. These are use cases where the function is very repetitive or sensitive to or prone error, right? Or requires speed more than what a human can manage on their own. So that's where we built robots or bots to do that function. And the last but not least is software development, which is, at times when we see that the market doesn't have what we need or we cannot afford it, we will write full stack software to help deliver what the business is looking for. This includes obviously just using data signals or creating a workflow that involves some bit of data, but is mostly related to keeping a certain function structured. So those are my five areas of where I help Hackensack. I've been in healthcare for quite some time. This is my third healthcare system that I worked for in the capacities that I described. I've also worked for Deloitte and McKinsey. This has allowed me to look at the healthcare problem from a different lens, and also has given me exposure to more than just the employers that I worked for directly. It has allowed me to go into other health systems. I think my last count was around 20 or so, and look at what they're doing really well, what they're not doing really well, and have a seat on the table to discuss what needs to be done to fix it.
Yeah, really compelling background and the right person to share insights about the topic. I was struck as we were preparing, and even as you said it again, almost how you've curated that portfolio. So maybe as a first question, why do you think, or let's ask it this way, what are the functions you think it takes to come together to successfully leverage AI and technology? Because you were very deliberate about what areas you brought together to do that, and I'd love for you to share a little bit of that with the audience.
What it takes is, I think, first of all, a lot of persuasion, some bit of prayer, right, and I think relationships, right. I think what allowed me to have what I have today, and what I have today, I do consider ideal, at least in my current mindset. Required a lot of explaining why these things have to work together to deliver the impact. The reason I say that, and the example that I will use is, me or the likes of me have been very good in leading teams that can build solid signals, right? Signals coming out of data that identify an opportunity. But I think without this portfolio, you can't do anything about the signal other than just handing it over to somebody, right? What this portfolio allows is it allows us to take that signal and take it to the next step, right? And it could be a robotics process automation capability that takes it to the next step. It could be a way by which we take that signal and built it into the right workflow. So that means we're delivering the signal at the right time, at the right place, to the right person. Putting it on a dashboard can only take it a certain way. And that's what like the likes of me did for years, right? We normalized data into a data warehouse, right? And then we built a dashboard that showed these amazing visualizations, but then it required somebody to look at this dashboard, right? And I'm not saying that's a bad thing and that doesn't work, but what I'm saying is what is ideal is if we can take that signal and actually embed it into somebody's workflow, right? Whether it be the form of a pop-up, right? So I think that requires the portfolio that I have, and potentially other portfolios as well, which is so my team builds that signal first of all, normalizes that data, then builds that signal, and then pushes it into where it makes most sense. And that's why this portfolio is so important.
Yeah, I think that's a really keen insight. And I don't know how many people are doing it, but I do know some folks who are sort of not just divorcing the signal from sort of the action that we've taken, but thinking about, as you said, maybe just thinking about the action and not connecting the folks who are driving what action to the signal. So I think it's important to, as you said, to have both. You've been at this a long time in a couple different roles. What originally sparked your interest in digital and AI, and in particular how to connect that into healthcare?
Yeah, so me, I started my healthcare career, doing EMR implementations, electronic medical record implementations. This is the system that health clinicians live in and document in, and this was like 2010, somewhere around there, right? And what piqued my interest is I don't think a lot was happening with the data that was being generated, right? So I think physicians and clinicians were doing a great job just typing this information in and reading from it, but that's as far as it went. And I very quickly noticed an opportunity that someone needs to take that data and extract it, right? And do something with it, right? And build those signals out. So I think that's what led me to where I am today. And obviously it has evolved over time, right? But that's the missing piece, I think. And I think more and more of that is happening today, right? I think those EMRs and all other systems have more data than ever, right? So now it's, in my opinion, the opportunity is just not building those signals, but it's actually just even consuming that information. So we are now using generative AI capability, for example, to summarize that information, because there's so much of it, right? I mean, nurses are putting that information in, doctors are putting that information in, information is coming from different devices into the EMR. Our watches are collecting that information and sometimes pumping that into the clinical record. It doesn't happen all the time. As a matter of fact, doesn't happen as often as it should. But the point I'm trying to make is that source is getting richer and richer, and the volumes are increasing, and these clinicians and the patients need help consuming that information. So I think that's what piqued my interest the most, which was how do we put that information to use?
And maybe we could dive in, I think to one of the key topics here, which is different ways that information is being used. So within your portfolio, you've got a broad way to essentially deliver that information. So to start with one, how do you see AI and automation currently transforming kind of day-to-day operations, whether that's improving efficiency, administrative workflow? And we'll try to tick off a couple different ways that signal and information is being delivered, but that's a place to start. So is that happening? Is it future? Where are we in that use of
Oh,
that automation?
yeah, it's happening. I think it's happening in a lot of places. Definitely happening at Hackensack Meridian Health. I'll use I'll maybe use two examples, right? So first, we unfortunately have always, in some form being patients, right? And at times that episode of being a patient involves getting discharged from the hospital, right? And then you come home. And the right way of taking care of a patient when they get discharged from a hospital is checking in on them, right? And that happens. Sometimes it takes longer. Sometimes in some health systems it doesn't happen, right? We just don't have enough people to call a patient and say, hey, how are you doing? Do you need anything? Are you taking your meds, right? And what we have realized is that while in certain cases we require a human to do that, there are certain cases and a lot of cases where we don't. We can have an AI agent call the patient and check in on them. Why is that important? That's important because if you check in on the patient, the chances of them having a situation where they need to come back to the hospital reduces, right? And therefore we benefit from readmissions, right? And obviously cost, and the patient benefits from it. So we built a capability, which is, and again, this is a good example of how that portfolio that I described has to work together, where we extract the patient, their under what conditions they were discharged out of our EMR, right, electronic medical record. We then prioritize using a logic of which patient should be contacted using a human and which can be done using a bot. And then on the bot piece, we make that call to a patient, right? And then ask the question, how are you doing? Do you need anything? Are you taking your medications? And if not, why not? Can we right now set up an appointment, a follow-up appointment with you, which was supposed to be done, or if you need one, right? And then once that information is collected, we push it back and have that conversation. We push it, well, first we connect that patient to either a human, if that's what happens as a part of that conversation, or we collect that information and, say everything looks good, but the patient could benefit from XYZ, or the patient is not taking medication, so someone needs to call and have a conversation. We take all this information and we put it into an actionable, call it for lack of a better term here, a queue for someone to do anything with. These actions were either not being done as much as they should have been done, or not being done at all, right? And that has resulted in us slowly working towards reducing our readmissions. So that's I think a good example of where we are using AI. What I described to you is a combination of robotics process automation, agentic technology, data and analytics, summarization, and conversational AI.
Yeah.
Probably a few more things as well, by the way, but this is where the portfolio comes together and starts to deliver using, if I was just a data analytics person, then it stopped at just giving a list to somebody to say, these are the patients you need to call. And then we're stuck there, right?
And a really compelling example of something that ideally, if resources were unlimited, you might even send somebody home with everybody, right? We know we can. So then we're saying, okay, so phone call, and we don't even have enough resources, or sometimes you can't even reach the person. So, and it sounds like that's one of many use cases where essentially automating a experience that theoretically could have been done in person, but we could never do at the scale, and sometimes even with the precision, using these tools. If we take off another use case, what about clinical decision support and leveraging that bridge between the best in class evidence or clinical research and how some examples of what you guys are doing at Hackensack Meridian to support not full automation, but better decision making from any number of clinicians or staff.
Yeah, so I think there's the good news here is that is a lot of those use cases are machine learning use cases. Why that's good is because we're good at it. The world is good at it. Today when people think about AI, people think about generative AI, right? But in fact, AI has been done for a long while, and that's what is machine learning AI. And I think most organizations are good at it. So building signals from data, as I described to you, is really helpful. Where clinical decision support comes in is where we are using data attributes within a patient record to early detect something. I only because I live in that space, I tend to say predict something. I sometimes have been told that that's too strong of a claim. So
I'm smiling because my grad work was in predictive models. So
yes.
the data scientists and us are happy to call it prediction, but yeah, I agree with you that in some cases I may run afoul of perceptions from others. So it's statistical modeling, right?
Yeah. So what we do is we provide early detection signals, right? In various disease types. The two examples that I'll share with you is that one is for CKD, chronic kidney disease. This is where we have built capabilities to early detect chronic kidney disease or chronic, especially like high stage 4 sort of a setups, right? And what that allows and ideally what that is it is a clinical decision signal that is sent as a suggestion to a clinician to say, hey, there are chances of this person eventually going into CKD, right? Therefore, let's do something about it, or should I say late stage CKD. So let's do something about it today. That intervention allows the patient to live longer, allows the patient to have better quality of life, and also reduce the cost of care. The other one, which is very near and dear to me, is where we have built a mortality model, right, within patients going through a chronic episode. And what that does is it allows us to start to engage end-of-life care sooner than later. And ideally what that is, it's what's called as a BPA, which is a best practice alert in the EMR. So the signal is built outside of the EMR, and then we push that signal through a best practice alert into the clinical workflow. And this is when we see that the signal is showing a higher chance of mortality within 1 year. And what that's allowing is sending the physician the reasons why, and having the physician consider bringing in the end of life care team, which could be hospice, could be palliative care, to have a conversation or start to have a conversation with the patient. Now, the physician at that point has a decision to take using what we provide them, and decide, no, this is not a good idea, and I think it's too early, or we don't need to do anything right now, or think of that signal as, okay, let me go back in the patient chart and have a look, right? And at times they come back and they say, that this is something that's required. Again, what that does is in this example is it allows the patient to have a better quality of life towards the end of that, right? And end of life, unfortunately. It avoids back and forth in and out of the hospitals, because certain decisions get made sooner than later.
Right. Let's look at, there's many other sort of main areas, but one other that's near, at least to my heart, is sort of how are we using this technology to, I like to use the word delight the patient, but let's talk about at least being more personalized, more engaging. Where are we seeing this kind of technology improve the patient experience? And the two examples you gave clearly do that as well, but focus specifically on whether it's data visualization, whether it's meeting people where they are, because there's a lot of interesting use of the technology in that ways as well.
Yeah. So I think what comes to mind is, we obviously there's a lot of room and opportunity around providing equitable care, right? Timely and equitable care to patients that cannot reach care. So there's a gap, right? And then we as a health system work very hard in filling that gap out. So we launched a capability, I think it's been over 6 months now, which is called HMH 24/7. This is a capability that all patients have access to, and what it does is it has an AI enabled triage in the beginning of the conversation, right? So this is primary care. This is AI enabled digital primary care, and the steps it takes is it does an initial AI enabled triage at first.
Yeah.
It then next goes into a telehealth visit, right, with a primary care physician, and then eventually either results in, if required, results in either doing a brick and mortar visit to a primary care or a specialist, right? And that, in our opinion, has helped a lot because I think the world has changed to a point where I think things are more the people are more accepting of this kind of capabilities, and they feel that they can just pick up that phone and have that quick call with a physician, right? The example that I tend to use in such conversations is I care for a elderly relative, and pre-COVID I remember asking her if she wanted to take a telehealth visit, and she said that no, I want to see my doctor I've been seeing for 20 years. Post-COVID, when I ask her, it's time to go to the doctor, she tells me that, can I take a televisit?
Oh, wow.
And I think
Yeah.
what, in my opinion, what COVID did is, among lots of things, is I think help us become more comfortable with technology. The reason I'm using that as an example here is because I think people are more accepting of picking up that phone and getting on a video call or even have AI help with a bit of the triage, right? And I think we are trying to fill the reach or outreach gap a lot using the digital means or technology means.
Yeah. And I don't know if we'll have time in this conversation, so maybe we'll have you back for a future. But my experience has been there's a real expectation difference by generation. So, yeah, as you describe, an elderly relative may not even want the technology, whereas I think there are some younger customers who, if I have to talk to somebody, something's wrong. Like I should be able to resolve all of this. And so I think one of the things we're facing is this sort of, you know, moment in time where there's different expectations almost by generation. Maybe we'll come back to that. As a reminder to the
And
audience, oh yeah, please.
Adam, just real quick, I do want to say, like, it's amazing how things are changing, right? I
Yeah,
talked about that post-discharge chatbot, right? Or that call that's made, and it's amazing what we experience there, right? We have elderly folks saying, I mean, I still remember this one where they were saying, "Hey, look, I'm talking to an AI," right? And they're testing it. And the reason that's important is because I think things are a lot better. If you look, it's not fair to look at that technology that was 2 years ago and look at the quality of the technology today, right? What was built was very intent based, so it knew what it knew and it didn't know anymore, right? It couldn't help manage, like, the management of conversation beyond context was very difficult by the technology. Today, using a large language model, it's a lot easier. So the
yeah,
thing is smarter. It can cater to more. Like, if you ask it what the weather is, and if we put that in there, it'll answer that, but it'll
right.
bring it back to the conversation. Versus in the past, if you asked it what the weather was, it would say, "I do not understand what you're saying." So that
Right.
technology has drastically changed. So the experience has changed.
That's really important, I think. So just a reminder to the audience, we will absolutely leave time for questions. Hopefully you're getting some. Easiest is to chat them in while you're thinking, and then we'll come back to it. So please do that. Sameer, shifting gears a little from the sort of what can we do with this technology to a little bit of the how. You talked about curating a portfolio, but you also talked about building credibility, alliances. Talk a little bit about how much collaboration is needed with your colleagues in other parts of the organization to make this happen. And maybe then talk a little bit about the partnerships you need outside of your own organization, whether that's the tech companies or other research organizations to really leverage this successfully.
Yeah, you cannot do this on your own, right? I don't do this on my own, right? None of these are a problem that I drummed up, right? Obviously, I've been in healthcare long enough to understand and appreciate where there are opportunities, and I do my best to express that. But this has to come from clinicians, right? So I think being with them, making this their problem and their success and their solution is very, very, very important, right? So I think having the people with you when you're either talking about the problem or describing a solution it has to come from them, right? Versus an AI officer, right? So I think that's number one. The other part is you cannot do it alone. Also, from a solution perspective, right? What I do appreciate every day is the fact that I work for a hospital system and not a product company, right? So there's only so much we can do. I mean, I'm blessed enough to have a solid portfolio and really smart people. Hackensack Meridian Health and the leadership has invested in that. So we can solve a lot of problems ourselves, but they cannot be done alone. So we have deep partnership with vendors, especially Google, when we're solving these problems. And they're in our office, in our discussions almost every day, right? We go and ask them and seek their advice and use at times build is not always a good option. So we have that build and buy conversations all the time with vendors, right? And then make a right decision for the network, for Hackensack, as to what makes most sense from the cost and a quality perspective, experience, speed to market. All that has to be weighed in. So I think it's really important that that you partner with these companies. It's really important that you partner with the people that you're trying to solve the problem for. In this case, clinicians and sometimes non-clinicians as well, because we have non-clinical use cases as well. These two relationships are extremely important. And then the third is, I think networking is really important as well, right? I take a lot of pride in listening to what other people are saying and doing, right? I think that's really important. There are really smart people out there. There are great health systems that are really taking care of patients as well as Hackensack is. And I think having a conversation around how they are doing it gets you to not just the problem, but also the solution.
I think that's absolutely right. If we dive a little bit deeper, all organizations are resistant to change, but healthcare has had this mantra of do no harm. I'm picking hyperbolic statements. On the other hand, move fast and break things. And I'm wondering how you bridge that cultural gap between, hey, we got to test some of this stuff, we got to see if it works, and at the other hand, someone's like, well, until we know it's perfect or it has a demonstrable improvement over the baseline, we're not going to do it. Talk to us a little bit about that kind of cultural difference.
Yeah, so I think there's a push that you make from top bottom, and then also from bottom top as well. What I mean by that is the innovation mindset and trying different things, safely, right, has to come from both sides, right? So I think the leadership has to be excited about it, right, which is thinking outside the box, right, and saying, okay, this capability doesn't exist today in a certain software that we have, but how about we built it on the side and then infuse it, right? So I think that starts to create a lot of confidence and starts to take away. So I think from going from the leadership top and coming down into operations is helpful, but then also from creating the champions within the workforce to say, I am a technologist, and while I may be a clinician, I understand. So I think explaining things to them, meeting them where they are is really important, right? One thing that I have taken a lot of pride in is that there is no point throwing technology at somebody and saying, here's the solution. That doesn't work. Instead, you have to appreciate how they do it now, and then understand and appreciate how it will be done as a result of this technology and fusing that together, right? I think that is what takes away the fear, takes away the lack of adoption, and there's a lot of room for improvement there, right? Because I think AI is coming so fast at us, but I think doing that is very helpful. One thing I'll mention, and this may be a bit slightly technical on the technical side, but having human factor engineers on your team is very important. What that means is these are the likes of industrial engineers that know clinical workflow, right? Is really important, because what they do is that they figure out where these signals fall in, where these capabilities fall in, right? They've seen it other places. They understand. They do the work of going into the clinical workflow at Hackensack and figure that out and then come back to us. So there's a lot of information that we get from them, and that creates the adoption and takes away the fears and a bunch of other things as well. One last thing I'll say is that we do a lot of show and tell. We do a lot of just like, I'll just call it the soft things that have to be done, which is, we'll go and explain AI, what it is and what it isn't. We will go explain what is automation, what it is and what it isn't, right? And how give them solid examples that similar to what we have discussed today. That helps a lot. As a matter of fact, that even helps us getting to the right use cases, because then people say, you know what, now that I understand it, I'll tell you what I'm looking to solve, right? So I
I,
think doing those road shows and being out there in front of people, that's huge.
I'm curious your take. You and I have both been doing this long enough that certainly when we started, there was just an inherent resistance, right? This is new. I'm wondering if you feel like we've crossed a point, and if so, is it the last 6 months, last couple of years, maybe it's COVID, where there's still a healthy dose of, okay, we need to know that this worked, but there's actually, in general, interest and belief that these tools can help. And so you're not fighting a perception battle as much as making sure it works, or do you still find just kind of inherent resistance, like you said, older folks won't use this technology, or we tried this before and it broke the whole system, or every time we implement something it makes it harder? I'm wondering where we are internal to, and that doesn't have to be specific to you, you talk to others, but internal to healthcare, in the belief that these tools are valuable, and now we're finding which ones, or we're still general resistance.
Yeah, it's gotten a lot better, right? I can tell you, it's gotten so much better. Things were really hard for the likes of people like me, right? Because people did there was a that I think technology was scary at times, right, to people. But I think post COVID, things have gone a lot better. The likes of ChatGPT and the blowing of the AI conversation in social media and many different places. The negative of it, the positive of it, is has that conversation has helped us quite a bit. And these are simple things, by the way, right? I'll give you a very recent example. So we have been working with some researchers building some capabilities where they can do research a lot quicker, right? So we built a research data platform for them, which helps them, find patients in a de-identified way, so they have a good sense of what's available and what the conditions look like before getting formally engaged and putting data engineers and data analysts on it, right? And now that we have generative AI in place, we were showcasing some generative AI capability for researchers. In that conversation, and it was sort of unrelated, someone mentioned that they were using our internal generative AI capability to put together a letter of recommendation. So these are a bunch of students as well, right?
Yeah,
And a physician there said, "Well, I don't quite agree. This has to come from the heart." That's what was shared. And I said, "Fair." I took down the clinician's name, right? And I contacted that clinician later on, and I pulled the screen up. I said, "Principally, I make sense, but let's see how this works," right? And I put a few prompts in, basic type questions, and I said, "Okay, let's start there." And I said, my question was, now that this draft is there, can you take this and make this your own?
yeah,
And the person was like, "This is beautiful, by the way. I didn't know that's what this was doing." Right? And I will totally use this capability because I see the value here. So I think doing such things has helped quite a bit. So I think things have become easier, is what I'm telling you. I didn't have that generative AI capability 5 years ago, right?
right.
To show to people that rapidly,
And I
right? To
think
start.
we're, to your point, we're not, 5 years ago, we didn't see it in our lives outside of work. And now I think
Yeah.
everyone has, or not everyone, but most people have a use case where X thing
Yeah.
got done better, faster because of this technology. And so now almost like, I've seen situations where there's actual like pull from the team to be like, why don't I have these tools already? Because I have them outside, which I don't think we would have heard a couple of years ago.
Yeah, I will say there's a place for testing and all that.
Yeah,
That's why like all our clinical use cases go through a pilot phase, right? To prove that point, to make sure that things are okay. So the testing, I mean, that hasn't gone away because of generative AI or AI of anything for that matter, right? So that holds a place. We test and try everything, especially when it's clinically required, right? And make sure everything is safe. So that world is there, and the push and attention in that space will remain and should remain.
yeah. So let's go a couple minutes before we take questions. So let's transition to where we're going. So kind of two questions about the future. The first is, I'm curious, you know, there's a little bit in the news about sort of AI maybe is plateauing, or at least the Gen AI stuff. Others think we're, still in very early days and this is going to be incredible. What's your sense on where kind of AI advancements in healthcare are going? And, in that context, what excites you most, for the next couple of years?
Yeah, that's a great question. I think about this a lot. So I think that we have made some major leaps as technologists when it comes down to AI. And I think the AI getting better story is going to slow down a bit, in my opinion, right? Because it's gotten really good, right? And now it's all about, I think what we will witness is fine tuning, right? Of that. Where we will see an acceleration is what do you do with AI,
Right.
right?
So not
Which is
the, for lack of a better word, the core foundational models, but the use cases that are built with the
use
tech
cases, yeah.
that's there.
And what do you do with that information, right? Is going to be so. I think that's where, and that's already started in the market, by the way.
Yeah.
The concept of agentic AI is everywhere now, and that's the future of AI, right? And to me, I mean, agentic AI means a lot of things to a lot of people, but to me, agentic AI is actioning a signal, right?
Hmm.
Which and again, us as a society, we'll have to get comfortable with what we need a human to action and what we need don't need a human to action. And there are things that we need just human to action. But I think that's the advancement that we will see is that we will start to see agents come in and action on AI signals, non-AI signals, things that we do not need a human intervention for. And I want to be very clear, especially in healthcare, right? You do need human in the loop and you require human intervention, right? So I think it is really important that we identify where human is needed, right? In which case we don't have agentic AI. But there are functions, especially in the back office space, and even sometimes even in the front space as well, that do not require certain signals for human to execute, right? So that's
Yeah.
what I think we will see. That's what I'm most excited about, which is starting to use agents where in places where it's most appropriate.
That's great. All right, so last question, audience, please send in your questions. We got a couple already, but now if you kind of zoom out even further and sort of think about the major healthcare trends, for the next 5, 10 years, where do you see this technology kind of impacting those trends? So, not to bias, but we could talk about work, staffing shortages. We could talk about transition to more therapeutics. So there's a number of sort of trends in healthcare that are independent of the technology, and I'd be curious to know which of those do you think are going to be most impacted positively or negatively by where we're going with AI and automation and things like
The first is I think disease detection is going to be really big, right?
that.
I think because there are ways and means to get access to data and make sense of the data a lot better, we as I think a community will start to use more and more data for disease early detection, right? As a matter of fact, when we spoke to the board as early as last year, identifying areas of opportunities for AI, disease detection came at the top of that list. So
Yeah.
I think where I am seeing is disease detection will become easier again. Without stating the obvious, the benefits of that are, I mean, is better healthcare,
Yeah.
reduced cost of healthcare, right? Because you early detect something, you're taking care of a patient better, they're happier, they're healthier, you're taking care of a
And I
patient
think
better.
particularly as we realize kind of how many of these conditions are multifactorial and how hard it is to see those patterns without technology helping uncover that
Yeah.
the sort of interactions of those things. Yeah, that's a really good
You know,
one.
a portion of that, which is sort of it's similar, but I think it needs to be treated separately, is there is going to be a world of precision treatment. We have talked about precision medicine in general, which is designing or building drugs specific to a patient versus a population. And I think this technology will allow us to start to create treatment,
Hmm.
and which is beyond just the medicine, right? Of how to treat a patient the right way, right? And that power, the processing power, is available today, and I think we'll start to see fruition of that as well. So I think so. It's the disease detection plus precision treatment. I think is going to be really big. The second or the third bucket, which is a larger bucket, is I think operational efficiency,
Yep.
clinical operational efficiency, non-clinical operational efficiency. I think is going to be huge. We deal with clinical, burnout day in and day out. There's just a lot these clinicians have to do every day, right? Nurses are running out all over the place, putting documentation together, taking care of patients, and I think I think AI is going to help with that. I mean, and there's products today already. Hackensack built a product where we are, summarizing clinical notes using AI. We have purchased a product that helps put the conversation between a patient and a physician into a note, into a good note that eventually gets reviewed by a clinician before it becomes a clinical record. But that power has been put together, that the power of putting that initial draft together has been very helpful for clinicians. So I think we'll use AI more and more to reduce or improve how we function administratively as well.
Sameer, thank you for the insights. We've got 5 questions in already, maybe slightly more than 5 minutes because we want to commit to everyone to not have them be late for the next meeting. So maybe we do a kind of rapid fire. But again, thank you. Really appreciated the insights, and let's see if we can answer some of the audience questions. So Neil writes, how can AI help improve patient-reported measures and patient-reported outcomes?
Yeah, it's going to take more than 5 minutes, but I will tell you that that I think I don't know if that's an AI play, right? I think it's more of an interoperability play. I think systems will over time very quickly will start to appreciate and absorb and consume signals coming from patients, from their watches, from sleep devices and other things. Today that is not that's more of a pull sort of capabilities only by certain use cases, but I think that will start to become very normal in general, and I think that's where patients will be able to report their measurements and their outcomes a lot quicker. So I don't think I'm sure AI has a play in everything nowadays, right? But
we're going to give you 45 seconds for each, so if you don't have the full answer, it's our excuse to convince you to come back on. So Sienna asks about claims denials and revenue leakage, and your thoughts on AI in denial prediction, appeals automation, and kind of end-to-end RCM.
Yeah, absolutely. So that's an agent use case. We are almost in the process of deploying it now, where we're using agentic AI to process a claims denial, or which is called putting together an appeals letter. Today, that's done by a human and 100%, and it will be done 95% by an agent and 5% by a human, which is they will synthesize the letter, generate a new letter, which includes adding modifiers and pre-authorizations or whatever that is, and eventually handing it over to a human that looks at it and says, looks good. If it doesn't look good, they move it to a different queue. So the 95% of the work will be done by agent, and then 5% will be done by human, versus today, 100%.
Great example of that first sort of bucket of automation. And
by the way, what that helps is obviously it reduces cost, which is a small piece of this, of processing or creating an appeals letter, but it also helps us with speed, because until we get that claim dollars back, right, we haven't made any money. So it also helps with cash flow.
So Sarah asks, says Hackensack Meridian, like many health systems, serves diverse populations. The questions around AI predictive modeling for population health and chronic conditions, I think broadly, but I'd love you to respond to, where we're seeing it maybe not be as strong as it could be for diversity. And, that we didn't get into it, but one of the big topics has always been bias in these models and things like that. So maybe a quick response on prediction and particularly in diverse populations.
Yeah. For the models that are, we test every model for bias. For the models that are specifically built at Hackensack, we take a lot of pride in making sure that we test it for bias. So that's number one.
That's great.
The number two is, as far as addressing diversity, the example that I gave for CKD, right, is actually with this angle, right, because CKD is actually is more prevalent in a certain population, right, and we identified that. And so the push was, so we are doing a lot of use cases at Hackensack today for around disease detection that are specific to a certain diverse population in mind. Obviously, bias testing becomes harder in those situations because the signals come out differently. But that is the case. Diabetes is something that we obviously it's front and center for us. I don't know if Hackensack needs to build that. I think vendors have that capability, and we just need to make sure we engage with the right vendor to do that. Heart disease is something that we are working on at the current moment, especially for CHF, right? We think we are really looking at this from a capability of how best we can cater and manage CHF patients. I think there's some opportunities for us that involve AI, by the way.
And Nick's question, I think, is a nice follow-up to it. He asked, there's vendors building a lot of these tools, but health systems sometimes need tailored solutions, but there's obviously a cost and a challenge. How do you strike that balance between building a custom AI tool like you described for prediction versus saying there's a vendor that may be good enough, or we can work with that vendor to get them to where we need?
Yeah, so we have a AI governance committee that helps us with this, right? Our job is to make sure we present the use case. So first of all, as you can imagine, is it a problem that we should solve? That's a part of the governance process. But then, how do we solve it? And when answers technology, we very objectively look at buy is this, and this is what it cost, and this is the time it will take us to go to market, and versus build, this is what it cost, and this is the time it takes for us to build up to market. So there's that healthy discussion and tension of build versus buy. Eventually, we do what is right for the patient. We do what is right for the network, right? But that governance process is actually what helps us get to the build or buy decisions. And I mean, very as much as I take a lot of pride in the team that I described to you, that makes us look good. I would say 70% of our use cases are buy, right, and only 30% are build. And that's okay. That's a good thing. Again, I keep saying this, right? We're not a product company. We're a health system. I know who I work for, and at times it makes sense to just buy.
We didn't get into it, but it might be interesting. My experience as I've watched major organizations do this is there's a huge amount of investment upfront in the, what people call ML ops, but I call it the plumbing and the tooling that enables you to deliver a model that could be your own or someone else's. And so I think, thinking about infrastructure investments versus the actual use cases probably is one of the things.
And those are very, very good conversations. I will say that you need that foundation, right? I mean, because you will not be able to deliver impact if you rely on just vendors, right? You need that foundation. Organizations have to invest in that and have both available as vehicles to deliver right care, which is build and buy.
Yeah. So two questions that ask your opinion on sort of general areas within the health systems and the use of AI. So Mary asks, how you see AI and particularly AI agents supporting providers in billing, scheduling, and care coordination. And then Simon asks how you see AI and automation evolving to support hybrid or virtual first and remote models. So, one's more of an automation play and administrative, and one's more clinical. But your take on those two areas for AI?
Yeah, lots of room, lots of opportunity, right? AI, I think in the spirit of me describing how AI is a lot better than it was years ago, I think the tech is here, right? I mean, if you look at the amount of money that has gone into AI deployment or AI development in the last few years, it's like it's so much, and it's starting to show. So what I'm trying to say here is that the focus on using AI in healthcare to support clinicians, to support patients in a more digital way, is already here. Just the fact that we have the Geminis and the Llamas and others of the world that we have access to today, right, shows that there's more help available than otherwise. And I just use that as an example, right, of what's available in the market. The investment in AI, especially in healthcare, is huge, right? So I think, in my opinion, that you will see more and more of that. The quality of what's being produced is a lot better than it was before. So I think I'm really excited about it.
That's great. So last question, and again, on one that could be a whole episode itself. So your quick thoughts. So I think we've got two competing factors, and Harry writes about FHIR and some of the government pushing interoperability. He didn't mention in his note, but we could say on the flip side, Epic just announced their own AI scribe. Cerner's doing the same. Do you think we're going to get more of a democratization given by the breadth of this, or are we going to see this coming back to whether it's Google and Microsoft and the big tech companies or the big health system vendors? What's your take on how it plays out?
I actually think that more people are shaking hands over data than it has ever been before, right? I think there's a place for standardization, whether it be put on FHIR or OMAP and all those conversations, right? I think those are more more conversations on efficiency than anything else. I think EMRs are talking to each other more than ever. EMRs are being asked to, or even from a regulation perspective, as a part of various bills that have been passed, are being required to talk to each other more and more, right? If you look at Epic alone today, the number of attributes that are available as FHIR APIs is more than I've ever seen in my life, and I've been working with health systems with Epic applications for over 15 years now, right? And that's a proof point itself, right? I can tap into an API today, right, and get almost whatever I need out of these systems. There's a lot of room there, but I think what this is resulting in is I think more and more data available and more interoperability than ever. I don't think the interoperability problem is going to 100% generalize and go away in the immediate future. But I think two things are happening. One is that I think systems are talking to each other, and other, I think we have more tools to consume this information, which is generative AI and others as well, right? So I think the connectivity piece is becoming easier, the consumption piece is becoming easier as well, right? There's a conversation in the market happening right now around whether we need FHIR at all, right? And why can't agents just generalize all this, right? So I think the tools are getting more and more sophisticated, which allow for sharing of data and sharing of patient information across Epic, Cerner, Athena, everyone.
I think unfortunately we have to leave it there. We went a minute over, try to promise. And Sameer, thank you again. Really compelling insights. It was a great conversation. Thank you for the time. To the audience, thank you for sharing just shy of an hour with us. Really appreciate the thoughtful questions. We will make this content available. Hopefully you found it valuable, and if you're interested to learn more, you can check out OSP's resources and the list of our upcoming webinars. We're excited to be part of that conversation about how technology is moving healthcare forward. So stay tuned for future updates. Sameer, thank you again. Thank you to the audience. We look forward to talking with you in the future. And everyone have a great
Thank
day.
you, folks, and thank you, Adam, for this opportunity. This was a great conversation.
My pleasure.
Thank you.
Thank you, guys.